Orbis has been working in India for last 2 decades, and we have been able to establish pediatric ophthalmology as a district subspecialty in India, working with various partner institutions across the country. 2021, the year has come with many challenges. As an organization, we adapted to the new normal with great sense of resilience in order to provide quality eye care services to the children and training of pediatric ophthalmology team in the areas where the services are not available. There were a lot of learning from the REACH phase 1. These learnings we have adapted in the REACH phase 2. During this period, we also realized identifying kids, asking them to come to the hospital was a challenge. So we developed a new strategy called door-to-door screening. So during door-to-door screening, the REACH project team visited household to screen children and identify those children who has refractive error and provided care. So we concentrated establishing primary eye care center in the areas where services are not available. Siliguri, we established this connect between the door-to-door screening and vision centers. We supported them to establish Green Vision Center, and there we have connected e-bikes to provide services from the Green Vision Center and deliver care at the doorstep. When we provide primary eye care, one of the challenges is continuous availability of electricity. These Green Vision Centers basically powered by solar panel. Few women-led Green Vision Centers in the state of West Bengal. As a pilot, we have done that. We have been able to see the increase of footfall of women in these vision centers. The vision centers run by women provide the confidence and comfort for women to step into the vision center and accessing primary eye care in the rural areas. One of the key area of Orbis is to train local teams, inspire them to provide required eye care to the communities. We have a teleophthalmology platform called CyberSight, and then we use this CyberSight platform to train local teams, ophthalmologists, optometrists, and other paramedical staff. We have been able to conduct various AI webinar to reach out to people and provide appropriate platform through which artificial intelligence can be accessed by the local teams in order to identify and diagnose correctly the people afflicted with glaucoma. We have also conducted series called Unlocking Possibility series around COVID-19. These are all experiences by different partner institutions we work with. Their experiences has been brought in through a web series or webinar series to let the other institution know how during this challenging time they can work differently. Pandemic also given us an opportunity to learn different way of delivering training. So we took this opportunity and created a concept called Digital Training Hub. The various people, doctors and nurses who would like to complete fellowship or complete training, but because of lack of time, lack of resources, they are not being able to complete that so far. Digital Training Hub creating these simulation programs, reducing the time of training that requires physical presence in the training institution. we conceptualize a training program for counselors virtually. It's the first virtual training program for non-clinical areas in India, and we could train 150 counselors across India from 30 institutions. And this particular program was supported by our long-term supporter, Kenneth Youngstein, who is also our volunteer faculty. So one of the flagship program in India is India Childhood Blindness Initiative for Orbis. It was started in 2002, and under this particular program we have been able to establish 33 children's eye care centers across 17 states. We have started a program at Sitapur Eye Hospital to establish children's eye care program, but before that we wanted to establish the quality management system at the hospital, and most importantly the improvement in the governance structure. I'd like to thank all the partner institutions in India diligently providing the care to the people who need the eye care the most, and the esteemed donors who have actually contributed or supported our ideas and concept. So this pandemic has actually brought in a lot of new knowledge to the work that we do. These learnings are going to be implemented or used in order to improve our program delivery not only in India but across the globe.